Hello, everyone. My name's Drew Bogard, and I am one of the regional directors with Forrest T. Jones and the MEUHP. And on behalf of all of the other regional directors and assistant regional directors, as well as our staff at our home, the FTJ staff at our home office in Kansas City, we'd like to say welcome back. And also, more importantly, in these unprecedented times, we want to say thank you for all that you do for the children across the state of Missouri. So let's jump into the presentation. What have we got today? We've got 10 ideas to help you get the most from your MEUHP health plan. Some of this is review, but there is some new information and new programs that we want you all to be aware of. And if you need more details on any of these, there are handouts to support most of these topics. Chances are you've been provided with those at some point, either electronically or maybe paper handouts, but they're also available on the MEUHP website. So Missouri Educators Unified Health Plan, MEUHP.com. And if you'll look under the resource library tab, there's a lot of additional detail and information about these programs, as well as a lot of other information. So be aware of that website and utilize that whenever you need more information, or definitely just reach out to us. First topic, replace your old ID card with the new ID card. Most of you are aware, hopefully, that you received a new ID card earlier this summer. Make sure and swap that out in your wallet or billfold. If you're having any trouble with receiving a prescription or something like that, make sure you've got the newest copy of your ID card. And Missy's number, email address, and number and extension are on the screen there. Feel free to give Missy a call, or definitely one of your regional directors, and we can easily order you a new hard copy of your ID card if necessary. And we can also email you an electronic copy pretty quickly in most cases. I will take this opportunity to remind you about one of the best functionalities of your MyCigna app that most of you have downloaded on your phone. As long as you've created your account in there, you'll always have an electronic copy of your ID card as long as you've got your phone with you. So be aware that there were new ID cards issued. Second topic is this new program that the MEUHP has created called the Cost Saver Program. And a couple things I want you to know about this. This is a program that is specific and unique to the MEUHP. This is not a Cigna program. This is specifically something that the MEUHP executive director felt pretty passionately about, and we created an incentive program, and we're calling it the Cost Saver Program. So other things to know, this is a completely voluntary program. So what is this about? It's designed to help inform you about costs on various non-emergency, key there, non-emergency medical procedures and treatments. So some of you are aware that the cost of getting care can vary pretty widely from one provider or facility to another, even within the same region of the state. So we've created this incentive program to help educate you and help you discover the costs of selecting one provider over another for the non-emergency medical treatment or procedures you're having. And not everything is eligible for this, but if you've got a procedure coming up, if you'll reach out to Tracy Perkins, and her contact information is there as well as on the flyer, and let her know what you've got going on, she'll do a little research for you, because a lot of times it's not easy to get at the cost for a lot of these procedures. And what she'll do is, if there's an opportunity to save some money by using a different provider, but it might require some travel, or it might not be the provider that your doctor wanted you initially to go to, if you'll choose one of those facilities that Tracy identifies, you're going to have an opportunity to earn a pretty substantial gift card incentive for making that choice. So you can receive anywhere from $125 up to $500. And don't forget also that most of you are on high deductible plans. And if you've not satisfied your deductible, in addition to the incentive gift card that you can earn, you're also saving yourself money by utilizing another high quality provider that may be substantially lower cost. So be aware of this program. Look at the handout that was provided to you. There was an email campaign around this. Most of you should have received the flyer. There is a frequently asked questions section on there that does a great job of explaining and answering a lot of detailed questions that we don't have time to cover right now. So be aware of that new program, great new program specific to the MEUHP. Next topic, number 3, Motivate Me incentives. Just a quick reminder that the Motivate Me incentives are available again. None of the cash values changed on those, all the same incentives Same cash values for those incentives as last year. There is one new incentive that's been added that we'll talk about in just a moment. Two things I want to remind you about on this. Make sure and understand that your Motivate Me incentives all reset July 1st. So even if you just feel like you recently did one of those things, everything reset July 1st, and you've got an opportunity now to earn those incentives again for this year. And don't forget that if you want to earn some of those higher dollar incentives or some of the rewards for coaching or this new incentive we're going to talk about, that you've got to do those 2 gatekeeper goals. So be aware of those. Look at the new incentives out there and refresh your memory on those. We've done a great job across the MEUHP of creating what I like to call this wellness culture, and this is really tied into that. So you guys are doing a great job on these, but there's always room for improvement. So what's the new incentive? That's number 4 that I just teased earlier. This is a new Cigna incentive that's been added to the Motivate Me menu, and it's around what Cigna has identified as centers of excellence. So what this is, for certain procedures, and you can see the procedures there listed on the screen, you can earn a $250 Motivate Me gift card incentive if you choose to have one of those elective procedures handled at a facility that Cigna has identified as one of these centers of excellence. So what is a center of excellence? It's a hospital or provider that's earned a top rating for cost and health outcomes for those different procedures listed there. And Cigna continually reviews this data and updates these lists. So if you happen to get one of those procedures done at one of those centers of excellence, you will automatically earn that $250 reward. So check in your My Cigna account under your rewards tab and see. Some of you may earn this as you go throughout the year and not even be aware that you've earned it. So know those centers of excellence. When you do a provider search, it will automatically default to bring these centers of excellence to the top of the list. And if you have any questions about that, certainly reach out to your regional director. Next topic, biometric screening. You all remember this one, know your numbers. So again, this year, that is a $50 gift card incentive for getting your biometric screening done. And remember, this is no cost to you. A lot of you will have on-site biometric screening quest events like we've done in years past. They're going to look a little different this year, possibly, maybe be a little more spread out. They've got some social distancing guidelines that Quest has to adhere to. So it might look and feel just slightly different, but same general approach. So be aware and watch out for the emails if your district is doing one of those on-site screenings. Every MEUHP district, regardless of size, is eligible to have one of those on-site screenings. So we want to encourage you to do that. And we also then want to encourage you to earn that $50 gift card. Next topic is the physical exams. This is another one of the Motivate Me incentives. And the reason we've chosen to highlight this one, it is one of the higher dollar incentives. After you complete your gatekeeper goals, if you will have a physical exam or a well woman exam for women, you can earn an additional $75 incentive just for doing that. And again, this is covered at 100%. It's routine preventive care that's covered at 100%, but you still earn that $75 incentive. So why are we doing this? Everybody's doing a pretty good job of getting engaged and doing their health risk assessment and attending one of those Quest events and doing the biometric screening and getting their knowing their numbers. But we need you all to take the next step and get engaged with a doctor to talk about those numbers and what's going on with your health. And you might be surprised to know that less than 50% of the women and less than 20% of the men that are covered across the MEUHP actually did a physical or a well woman exam last year. So these are important, and they're important enough that we've attached a pretty significant incentive to doing that. I will take this opportunity to remind you, if you are intent upon going to your doctor to get a physical or a well woman, make sure when you're scheduling it that you let them know that you're there for your routine preventive physical or well woman exam. And then also when the doctor steps in, make sure and remind them that you're there for your routine preventive exam, because you can easily wade into some territory where you might get charged for that visit. It's maddening, but protect yourself by saying those things and being aware of that potential issue. And there is also a new way to access a physical exam that we'll talk about in just a moment for some of you that don't have a dedicated primary care physician right now. Next topic is the virtual visits. This one has become more important than ever in these times of pandemic with COVID-19. I would suspect that more of you are aware of the opportunity and ability to receive care virtually through phone, laptop, or computer through these MD Live and AM Well. Some of you have downloaded the MD Live for Cigna or AM Well for Cigna apps in the past. That's not the way we're accessing this care right now. They've changed up the process just a little bit. We want you to either go to mycigna.com and log into your account there, or use your MyCigna app to access the MD Live or AM Well. So there's a tab on there, both places. It says Find Care and Costs, and one of the subheadings under there is the pathway to getting engaged with one of these virtual visits through MD Live and AM Well. And what I teased just a moment ago about the physicals, starting in late September, so it's not ruled out yet, but in late September, Cigna has worked with MD Live to be able to offer the opportunity to get a virtual wellness physical exam. So to do your routine preventive physical through a virtual visit with MD Live. So that's a great way for some of you that don't have access to a primary care physician to go ahead and earn that physical reward, that $75 Motivate Me reward, and also more importantly, get engaged with a doctor and talk about your health. So it does require a little bit of lead time. You've got to schedule this virtual visit for a physical with MD Live. You've got to schedule it a minimum of 10 days out. And you do also have to go to one of the in-network labs and get your routine preventive blood work done. You got to have those results. The doctor's going to have access to those prior to your visit. So be aware of that. Great new program, great way to access some virtual care there. So next topic, the EAP program. Again, you've seen the flyers on this. Just a couple of things I want to remind you about on that. This has become more important than ever in this time of pandemic as well. Remember that this is a no-cost service to you, and it's available to anybody in your household. So they don't have to be on your health insurance. And what is this? It's primarily counseling resources, but it's also much more than that. There are some resources in there for some limited financial services or some limited legal help, but it's really primarily focused on the counseling. And any issue, any reason, you can reach out. It's unlimited phone counseling, and if the issue is involved enough, you do have access to 3 face-to-face visits with one of the network providers for that program. So be aware of that EAP program. Put the number in your phone. Remember that that resource is available to you. Number 9, save money with national labs through Quest and LabCorp. Most of you have heard us talk about this one before, but there are pretty significant savings for lab work available through Quest and LabCorp. Those are big nationwide providers that Cigna happens to have the deepest discounts for. And you can see some real numbers there illustrated showing what the discounts actually are. If you're curious about where a Quest or a LabCorp location might be, just Google Quest or LabCorp. And on their websites, they've got pretty easy search tools by zip code where you can find a Quest or LabCorp facility. So, and even when you're just doing your routine preventive blood work with your primary care physician, request that they send your diagnostic lab work to Quest or to LabCorp. They know about these, and a lot of times they have access and the ability to send that blood work out to them. Last topic, COVID-19 enhanced benefits. Some of you are aware that most of the major health insurance providers across the country, including Cigna, enacted some provisions to have no-cost treatment for COVID-19 testing and also the treatment. The MEUHP also adopted those protocols and procedures whereby they're not going to charge you as a member anything for COVID-19 testing, or God forbid you should ever need some treatment related to COVID-19. All of that originally was set to expire July 31st. It has been extended through the end of October, so through Halloween, October 31st. If you should need COVID-19 testing or COVID-19 treatment and care, it will be no cost to you. Even if you've not satisfied your deductible, it's still no cost to you. The MEUHP is picking up the cost of that care. I will remind you that on the testing, It is for the COVID-19 virus. So it is the virus testing. It does not cover the antibody testing at no cost. Cigna will allow you to get an antibody test, but if you get an antibody test, that will be at your own cost if you've not satisfied your deductible. So this is a great benefit that's been added to the MEUHP program, and we want you all to be aware of that. So that wraps up our presentation today. And if you have any questions about any of this material, feel free to definitely reach out to us. And once again, thank you for your time, and thank you for your membership in the MEUHP. We absolutely appreciate all of you, and we're honored to be able to take care of your health insurance for you. So thank you very much.